everybody, our TikTok family, and our social media. This is Dr. K from PCH Med Spa, and we're here with Suke, our patient coordinator. She speaks Spanish, and all of our staff are very informed about the lasers that we do, okay? And we're finishing one right here. This is the endolift, of course, for neck and face sculpting. Yeah, you can see a little bit of it. Any questions you guys have, shoot away. And I'm gonna share some insights and do a Q&A with you guys while we're finishing this procedure. It's pretty much all done. She's gonna get great results. The first case we did was very interesting. It was a young Puerto Rican gentleman with darker skin, Fitzpatrick 5, kind of like Charles Barkley, okay, a little bit even darker. And he came with acne scars. So that treatment is tricky because they can't do a lot of these resurfacing lasers because of chance of pigmentation, right? But I told him you came to the right spot, and he actually found us on ChatGPT because we can do the microneedling, microchanneling, boosters, the Sculptra, biostimulators, collagen threads, very important. But above all, we can use this laser and go under the skin. And that's what makes us very unique as far as a treatment plan for darker skin, okay? Because this laser does not pigment, it goes under the skin. So you can blast the skin and it will not pigment. So I told her, you're in the right place, and we started the treatment for him. I'm gonna share the results for him. He's gonna come once a month. And so if you're suffering from acne scar, this is the place to call, and we will have a variety of treatments that will definitely improve your acne scars, which is, by the way, challenging to treat, okay? With that said, if you have any questions regarding acne scars, pigmentation, which lasers can I do and can I not do, this is your time to ask questions from me and Suke, and I'm going to have you also watch the rest of this treatment, okay? Go ahead, shoot your questions.
Okay, and we do have a question here, Dr. K. So someone asked, can you still get laser CO2 with diabetes or endolift? So that's their question. Their question is if they have diabetes and they can get endolift or a CO2
Very
laser.
good question. Who asked the question? Do we have a name?
This was user 504. I'm not sure.
User 504, thank you for joining in. And the answer is yes. If you have diabetes and if it's controlled, of course, no worries at all. You can get any treatments or surgery, no problem, right?
Yes.
If you don't have a controlled diabetes, meaning like your A1C is above, let's say, 8 or 9, sugars are all the way up and down, so, that's a different case. The surgery, of course, facelift, those things, you got to get the pre-op clearance and go through all that process. With the endolift or CO2, we can definitely do it, we just have to do the consult, kind of prep you, okay, manage your diabetes if you don't have the best diabetes doctor. And that's what advantage with us. I'm an internist, rheumatologist, and now the aesthetics, so I can manage medically what is necessary for you to have a successful treatment. Whereas a lot of clinics who have, mid-levels or nurses, it will be more challenging for them to get you ready for the right treatment protocol, which is first, safe. Safety first, and then results. With us, it's always both. We always deliver results for you.
Perfect. Thank you, Dr. K. And anyone else has a question for us, Dr. K is here live. We will be showing you a little bit of an endolift procedure. And you can ask us any question. Someone else asked, Sugar H2O, thank you for your question. She asked, what is the percentage amount of tightening of the skin with endolift?
Okay, thank you for tuning in again. That's an interesting question, And what would you say, Suke? You've seen a lot of results, including your mom's.
Very good results. I'm going to say about 95% skin, 90 to 95. I would say every patient is different depending on the laxity. So that's where the results depend on your skin laxity.
That's true. So, yeah, you're absolutely right. It varies patient to patient. There's a lot of factors. We're still trying to figure out exactly what factors, but we try to improve your chances. How? Sometimes we put you on the peptide shots, collagen patch. We tweak your diet so you get the most collagen production. Okay, but it's definitely, like Suke said, it's very different person to person. A lot of it is kind of a medical mystery. Why someone gets amazing results and someone gets like a so-so or okay results. Okay, so the percentage, I would say between 50 to 90%, like Suke said. Some patients can get really 80 to 90% of tightening. And that usually happens with slimmer faces, ages 35 to 45. People who do not gain weight, they're healthy, and they do some maintenance treatments here and there, okay? If your age is above 45, you still get results, but it will be somewhat different. There's always exceptions, okay? We do get great results in 72-year-olds, and sometimes we don't get the best results in 41-year-olds, okay? But then we don't a lot of clinics just do this treatment and leave you alone. And so bye, go back to your town, wherever you're from. We got your money, goodbye, next. So we don't operate like that. If you're out of town, it's different. We do virtual follow-ups. If you're in town, you'll come back in a month, in 2 months, in 3 months. We do have treatment plans. Like this beautiful lady here, she's 52-ish. She's going to come back in a couple months. We're going to do facial balancing. We're going to add to her results. Okay? So we combine treatments and protocols to get you the best results possible. Okay? And it's not always easy. So sometimes in the interim of experimenting, we come up with new protocols. Like I'm doing a few things different for her today. Which of course is if I tell you, you won't understand. It's technical, but the lasers, the combination, the boosters we use. So we always, for example, add the Toscani boosters. These boosters are very expensive, customized cocktails that we put afterwards to enhance your results. So there's so many things. Of course, some of the secret, because that's what makes us unique and different from X and Y Z clinic. More questions? Shoot.
Some, here's Dr. K doing endolift. And he's doing the face and the neck. We are located in Newport Beach. We also have an office in Arizona, Fountain Hills.
Yeah, we extended. So tell them our new hours.
We do have extended hours starting this Monday.
Mm-hmm.
Monday and Thursday we have our new hours from 8 p.m. to 7:30 p.m. to every patient that is not able to be here by 5. So we extended those hours just for you.
So longer days on Mondays and Thursdays.
And on Thursdays, correct.
Open till 7:30 p.m. We start at 8 a.m. So we have almost 12-hour shift, almost like a hospital, so that if you're working, you can come after work. If you want to come here before work, guess what? You can be here 8 a.m. sharp. And I won't be here, but the girls are here. They will take care of you. Maybe I'll get a little bit, less lazy and I'll come at 8, but I start around 9. But my nurses and my staff prep the patients, so when we start, because it's about an hour to get you ready for something like this, You gotta prep you, paperwork, pictures, 3D imaging, right? It's okay?
Yes.
Yeah, get you the medications to prep and, get ready for. So takes about 45 minutes. So always prep for that. Always arrive early if you're doing endolift or something of that nature. And while we're doing this, I'm going to switch to a different laser so I show you what else we have extra that no other clinic has in the States. And what is that called? Okay, laser.
This is the light scan fractional.
No, we're going to do the other one actually.
Oh, okay.
So the laser bio,
Laser bio.
Laser facial. So I call it laser facial now because it's easier for patients to kind of grasp and understand. So we are done with the endolift. Took us about 2 hours or so. Very detailed work, but I'm glad we did it because we knocked off 10-20 years today with hers. And this is our laser bio, okay? It's a laser facial. So all these other areas that I'm not doing my endolift, which is like the nose, you know? This stimulates your stem cells, activates your skin, gets your lips more red, disinfects your clean. So all the insertion points, I disinfect. I kill all the bacteria that could be all these areas. So we do a few things. We get you a little brow lift, and I'm gonna do this side, Suke, and you can show the audience on our TikTok how nicely we can get a nice brow lift here doing this laser. So, and this was just it's great for hair, by the way. So she's not doing hair, but we're kind of disinfecting and lifting everything. And here we go. Just take a look now. She's got more brow lift on this side. See, her line is here. The natural line is here. So right away you can enhance the lift here. You know, do a little bit here. We did endolift on these areas. Most clinics don't do that, but I think it's great to do it because you will get some lift, and also look at the brow lift already.
As you can see, this is done directly on live. You can see the brow lift already.
Very quick response to the skin. She's very beautiful. She's very healthy skin and responds very nice. Look at that brow lift, see? So, and this is something, a laser facial you can get before a party or wedding or your seminar, conference. If you're speaking, this will get you a nice gentle lift that is good for a few weeks, sometimes more if you do, if you do them repeatedly, and it will really make your skin more beautiful. And see, we have a couple of insertion points here, right? So what do? We disinfect everything, make sure she goes home with all the bacteria shut down, because this laser will kill all the bacteria here. So we disinfect. Okay, so these are little things, but they add up. When you do all these things together, what happens? They add up. So let's do a little brow lift on this side. Okay, so any other questions?
Okay, there is a question here. Yeah. Someone asked, what's the difference between ultra clear and endolift?
Ultra clear, probably. Ultra clear, it's either an ultrasound treatment. That's what it sounds. To be very honest, I don't exactly know. I think it's an ultrasound. Ultrasound is a horrible modality for the face, especially the older generation. Or the soft wave maybe a little better, I don't know, but it's probably milder. So, but the old one, the HIFU, horrible, because it randomly shoots ultrasound and shrinks your collagen, shrinks your fat, shrinks your deeper skin. Not good. The first year may look good, then next year you're like, what the hell happened to me? I aged 20 years. So don't do HIFU. If you want to do ultrasound, definitely talk to us. We do have a new treatment, by the way, from Korea. Show them the machine.
This is the new machine.
What is it called?
This is all tight.
Yeah.
There you go. This is our new machine from Korea.
Right. So, exactly. Full disclosure. The All-Tight is pending FDA approval, and we're doing case studies. But we bring patients and limited availability, of course, right? We do the imaging and skin studies and do the treatments. It's very discounted, so you can talk to us about it. But it's amazing because it layers your dermis and this mass, which is the deep layer, but it spares your fat. So it's a new technology that is available here for us to do our case studies, and we'll just have the machine for the next 2 months, and that's it. Well, hopefully we'll have it back soon. So if you're interested, contact us, talk to Suke, and we can get you a treatment set up so you can experience it. It works very nice, no numbing, no downtime, and no pain really. It feels like a hot stone massage. Any other questions, guys? We are finishing the laser biolift, so show them the brow lift now on both sides. She got a little lift here. She got a beautiful lift here. So these are, she's gonna be a happy camper. And the endolift, we blasted the face, but I think the downtime is gonna be very reasonable for her. Yeah. So
and thank you everyone for joining.
Yeah, laser facial.
Again, this is right after the endolift laser. Yeah. She's doing the laser bio, which is an external laser.
Laser bio or laser facial, okay? Another minute and we'll wrap it up. If anyone has any final questions, folks, this is your chance, or you can also message us or DM us or write comments under posts when we get back to them. So,
and we do offer general and virtual consultations for all our patients that are far away or even out of state. We do have a lot of patients that come out of state, so we do offer the virtual consultations. Dr. K will give you a quote and we go from there. We book you to come in so you can do the treatment the day of.
Awesome. Thank you, guys. We're going to do another laser now on her, but we won't share with you. This was a long session. Thank you for joining. Have a great weekend and consult us for your aesthetic concerns. We are always here to help you. Thank you, and thank you, Suke.
Thank you, doctor.